When approaching a scene as the first responder, there are some things you must consider before making the call. The environment, patient needs, and transportation will play a role in the type of equipment and the amount of people you need to manage the call effectively and efficiently. Though we want to address the call quickly, having a rough idea of a plan of action can greatly assist later while managing the call. Once on scene, take note of the environment you are in. Evaluate how safe the scene is, and consider any hazards that need to be managed before entering. Is there anything electrical or mechanical present that needs to be turned off? Are there any natural hazards, like a downed tree or deep snow, that will make reaching or assisting the patient difficult? Many environmental issues can be solved with equipment or assistance from personnel. A saw can make quick work of a troublesome tree. However, if you do not call for it, you cannot assume it is coming. Assessing your patient's airway, breathing, circulatory condition, and identifying any deformities can help you make the decision of what first aid equipment you will need to package and transport your patient. A deformity in the spine will require a backboard and potentially up to 4 adults to move the patient. Remember, our goal is to quickly get the patient into a safe place and to the next level of care if necessary. Having the appropriate amount of help and first aid equipment will greatly assist in the process. Having too much, or worse, not enough, resources can add a significant amount of time to the rescue. Before making your call for support, consider what your patient's transportation needs will be. Often, this includes a toboggan. However, a toboggan may not always be enough. Consider the need for a snowmobile if you are far away from the first aid room. If the patient is inside, a toboggan is useless, and you may need additional personnel to carry the patient. A wheelchair or stretcher may also be necessary. Having a plan will greatly relieve your patient's anxiety of the situation, and the rescue time can be greatly reduced. Having a plan of action before making your call for support can reduce the rescue time. When making the call, use what you know about the environment, your patient's needs, and how you plan on transporting your patient to determine the amount of support you need as well as any equipment. Remember to always base your decision on your knowledge of the OEC curriculum and your own personal needs. Again, doing this can greatly reduce your patient's anxiety and will help you manage the call effectively and efficiently.